Healthcare is a disaster, especially for women.
Women suffer so much. We're left out of medical research and we don't get the right care and guidance, or things are super normalized.
If your hormones are balanced, you feel great. If your lifestyle is not exactly balanced, you stay up all night, you party a lot, you don't exercise, you eat junk, you drink alcohol, eventually your hormones are not going to be in balance. Since when are hormones bad for you? Common sense does not enter in the equation when you're talking about conventional medical care. We're not trying to replace the hormones. We're trying to supplement them. We're trying to rebalance them. Everybody's on birth control pills, and if you're going to have sex, condoms, because birth control pills won't protect you from sexually transmitted diseases, and they will also screw up your hormones. PCOS is pretty much the diagnosis du jour. It's kind of a throwaway diagnosis because you have nothing else you can say. The problem with PCOS is that nobody really cared about us enough to study us, to figure out what would help. I can tell you birth control pills won't help.
Welcome.
Thank you. It's such a pleasure. And in person.
Yeah.
And to be here.
Yeah.
How cool is that?
Yeah.
Amazing.
No, I'm really excited to talk to you. I told you before we started recording that I've been listening to some of your other interviews, and I just think that you're incredible. So to start, why don't we give the audience some context? You can tell them a little bit about what you do. But also, I think how you got into this work is really interesting, and it really informs why you practice the way that you do.
The boring part is I'm a doctor, like a conventionally trained doctor. And I started by running a trauma center. And then I went into private practice because I wanted to have contact and connection with patients, because I made the mistake of thinking that going to medical school was going to give me the opportunity to be a healer. How ridiculous. Well, then I realized it didn't. And then I took a turn. And when I took the turn, it was really early 90s. Like, I don't know, you were born yet. But
85.
Oh, okay, close enough, close enough. You look gorgeous anyway.
Thank you.
But anyway, there was no help. There was nobody there. And I thought, life is a continuum of health with small interruptions when you're sick. So why are we doing it the other way around? It made no sense to me. Now it makes sense to everybody. So first I got into hormones because I had patients who were taking hormones and were doing okay. But, you know, this is before hormones became like bad things. So they were taking them, but they weren't doing so great. And then one patient came and she asked me to write a prescription for something I had never understood, I had never even heard of, which was what we call now bioidentical hormones, as in what our body makes. And I wrote the prescription, and it went to California someplace, to LA. And she loved it. And then a few years later, I went into menopause at 46. And I was taking the same hormones I was giving everybody, and I started feeling horrible. I was bleeding. It was like stupid.
So you mean synthetic hormones, right?
Well, you know what? Everything's synthetic because it's made in a lab, so it's pharma. But they have to look molecularly like what your body makes. So I called this guy in California who was a compounding pharmacy. I didn't even know what a compounding pharmacy was, to tell you the truth. And this is me being a conventional doctor, keep in mind. This is how much conventional doctors know now, 30 plus years later, the same thing. So anyway, I called them. I asked them to send me whatever I had sent to that patient. He sent to me within 2 weeks. I felt like myself again. But I needed to literally a PhD in biochemistry to be able to do what he said, which was some stuff was creams and some were tablets and some were powders and some you had to refrigerate. It was ridiculous, really. But I did it because when you're desperate, as you know, you do a lot of stuff. So I did it and I felt fine. So I called the guy and I said to him, listen, I have a lot of patients that could benefit from this. And so I need the science behind it because remember, I'm conventionally trained. And he sent me the science because it was before internet, of course. It was in the early 90s. And he said, fine. So I realized it was like $400+ a month, which was a lot of money then. And insurance, of course, didn't cover anything. So I asked them, is there any way we can get a better deal because my patients are not going to be able to afford it? And he told me, I don't need your patients. So he did me the biggest favor because what he did is he opened the door for me to to figure out how to do it. So I found a compounding pharmacy locally where I am in New York, and I worked with the compounding pharmacy for 3 years, and with my patients is very willing to work with me. And we came up with what became the Hormone Solution, which was the first book on it that turned out to be number 2 on Amazon because it was at the right time in the right place, because the Women's Health Initiative that studied the destroyed hormones really for no reason. I'll explain that to you if you ask me.
Yeah, I wanted to get into
I'll
that, the correlation that they made to cancer. Is that what you're referring to?
Yeah, the whole study was just like ridiculous, but I'll tell you about it. Anyway, and so all of a sudden, I was the expert. This is how we become experts. And then the rest is history. But what happened was that the Women's Health Initiative looked at, like you said, the wrong hormones. They never looked at bioidentical hormones, which are called natural hormones, because they look like what our body makes. And I've never seen a 20-year-old who's full of hormones, who gets really sick, who has problems with it. You know, pregnant women are overflowing with hormones. I mean, since when are hormones bad for you? It's just like common sense. But common sense does not enter in the equation when you're talking about conventional medical care. Anyway, so the study was fully paid for by Pharma. Now, nobody knows that because it was a government study. And Merck and Wyeth and, Upjohn, all the Pharma paid for the hormones that were distributed to the women that were tested, and the academic institutions received them. The government took the money, the academic institutions took the money. The women were women who were post-menopause more than 10 years. They had pre-existing conditions. They were smokers. They had all kinds of other problems that now you wouldn't study those women as your example of who you want to give hormones to. But anyway, when the study went askew, which was like 5 years in, what happened was that they got scared that the truth would come out, and it still hasn't come out really, but they were scared that it would come out. So what they did, they said, all hormones are bad for you, get rid of them. 7 million women were taken off hormones. That's a lot of women. And you know what? The North American Menopause Society, the American College of Obstetrics and Gynecology, who are the OBGYNs who, were supposedly the experts, who know nothing about hormones really, because they don't get taught anything about hormones, turned around and said, no more hormones. And what's the option? What's the alternative? The alternative was you dress in layers. So if you get hot, you can take the layer off. And if you get really hot, you could drink some water or whatever, which I thought was beyond offensive. And that was before the IUDs of the world came to save me, literally, because it was like screaming in the dark. And I was busy. Patients came. They believed me. I did well. They did well. Nobody got cancer. Everybody did well. And eventually, it turned out to be the right thing. But it took a long time. And now, this is the funny thing. In 2011, I went to a conference in Italy, because it was in Italy, really, to tell you the truth.
I would do the same thing, by the way.
It was beautiful. It was really beautiful. But it was the International Menopause Society. So they were talking about hormones. And there's such a thing, it's very confusing, but I'll make it very simple as far as I can explain it, because it needs to be explained. There is no such thing as class effect, meaning all estrogens don't behave the same, all progesterones don't behave the same, all progestins, whatever, they don't behave the same. If they don't look the same molecularly, they don't behave the same. So to say that everything's bunched together is horrible, and it's cruel because it's not true. So at that conference in 2011, there were researchers who said that there was no class effect. However, the information never crossed the Atlantic. I came back. I told everybody, well, we're right. We did it right. It's right. Makes sense. Their doctor said, no, they cause cancer. Excuse me, there's no data. In 2013, they came out. The principal investigators of the Women's Health Initiative came out and said that there is nothing to worry about, because when they compared the women in the study with women who were in placebo who didn't get the drugs, there was no change in what they call all-cause mortality. So women, nothing happened. So this was a really horrible thing. But guess what? The media did not cover that study, that report from the principal investigators. It was like just didn't exist. So it left a lot of women wondering, and I still see women. I mean, at this point, everybody knows what I do. I've been doing it for 30 plus years. Turns out to be right. People come in and they don't question me. They just say, what's the story with that? And now you know what the story with that is. It's just yet another way women get screwed.
As you're speaking, I'm just thinking in my head, women suffer so much, and we suffer so much unnecessarily, whether it's because we're left out of medical research and, we're left to our own devices, or because we don't get the right care and the right guidance, or things are like super normalized. I'm just thinking back, this is kind of a random example, but something that I know a lot of people have been through. I got an IUD many years ago. I had it for about 7 days because I had insane pain. My irritability, anxiety, everything was off the charts. And my doctor's solution at that time was to go on an opioid. And I'm sober.
Of course.
And even if I wasn't sober, I wouldn't want to do that. But it was the most painful, traumatic thing. Colposcopies. I mean, all of these procedures
that you didn't need.
That are horrible.
Just take it out.
And it's so minimized. And I know so many women have been kind of traumatized by this. So,
really traumatized.
just so many things. But I guess I want to start at how do we unwind what is a hormone issue and what is a lifestyle issue? Because I feel like they're so intertwined. And, another example of myself, but I know that a lot of people go through this. Like, I've had PCOS for many years. I've been told that it's kind of lifestyle, but then other doctors say to go on birth control. There are all these things, and especially now because hormones are so trendy to talk about and there are so many hormone experts, and it's hard to even know, where do I even start? Is it the lifestyle habit? Is it the hormone? What's at the root of it?
Good question. They're long and they're good, and now you're testing my memory, right? So this is the thing. First of all, let me address the last thing. The reason I came out and I'm doing what I'm doing now is because there are too many self-appointed experts in hormones. They don't know anything about it. They have no experience. I've been doing it for 30 plus years. I pretty much started this. And it's just, for me, because I love women, obviously, I've proven it. It seems horrible that you're also capitalizing on our fear and our lack of information sharing. So that's why I came out, because I think it's time to tell the truth. And that's why I came to you. That's why I'm going to go to anybody who will listen to share the information, because we need to change. This has to change. Healthcare is a disaster, especially for women. So that's one thing. We'll address the rest of them. When you're talking about hormones, right? If your hormones are imbalanced, like we mentioned before, right? You feel great. However, if your lifestyle is not exactly in balance, you stay up all night, you party a lot, you don't exercise, you eat junk, you drink alcohol, eventually your hormones are not going to be in balance. So it starts with the hormones. So if your hormones are out of balance, you're not going to be okay. And when you look at lifestyle, and this is how I learned about it, because I started with hormones, then I realized that thyroid and adrenal, which are hormones too, were part of it. And in order to get things better, I needed to fix that. But once I realized that, and I do it kind of in a layered fashion, I realized that I had to know what my patient did, who my patient was. I had to know everything, because the closer you and I are, the more likely I am to figure out who's doing what to whom. So lifestyle is crucial, but you figured that out already. I think a lot of people are figuring that out. So
but my hormones are still a mess.
Well, happy. I'll take care of that. That's easy, actually, because your lifestyle is great, because you realize the connection. It's easy. What becomes important is the right hormones because, as I said, there are people with 10 million followers who have no idea what they're talking about. And then they show up in my office saying, but I'm taking all this garbage, which is garbage basically, and I'm not feeling better. And it breaks my heart. And it takes me back to a story about now I'm thinking about. In the early 90s that I was like, I did a thing on CBS and I had to go talk to them. And there was a conversation with a woman anchor, of course, who asked me about studies on women. And why were women not involved in pharmaceutical studies? And I said, because nobody cares about us, because they think we're little men. And it was like a big, oh my God moment. But the truth is, nothing has changed. Actually, it's even worse now. It's even worse now because the more we talk about it, the more we realize that we're not there. And the other thing is, and I'm not trying to make it negative because I'm very positive and I'm all about changing the world to make it a better place, the healthcare system at least. And it's all about positive. But the thing is that it's not going to get positive until we take ownership of our own health. You did that. You know, I was listening to you, I was watching you, and I was so impressed with what you've done because you have done exactly what I'm teaching 45-year-olds, 55-year-olds to do. Because the moment they own it, the moment they say, this is my life, I'm going to listen to what you say, but you, the doctor, don't live in my body. So if it makes sense, it makes sense. If it doesn't make sense, maybe I won't. And that's my goal. And that's why, I have this book called Don't Let Your Doctor Kill You that is being re-released in July or so. And what I did is I added to it, I added COVID and AI and how things have changed in there. But the point of that book was, doctor does not know best. You know best. And I'm going to tell you a story that's going to make your head spin because I'm still spinning about it. A few weeks ago, and this is really recent, I had this woman come in, a new patient, and I don't really take new patients unless they're related and I meet them and I know them and whatever. So she came connected to one of my patients and she had been diagnosed provisionally from California, she came, to have some kind of very low grade, possible, not even probable, possible thyroid cancer on a biopsy. So let's pause here because we will react to that immediately and say, get it out, because that's all we think about, because that's how we've been trained. So I look at so she said, I need you, Dr. Erika, to help me figure out my hormones because afterwards my thyroid's going to be a mess. They want to take my whole thyroid out. So I go through the report with my physician associate who's been with me for 6 years, and the two of us really research everything. So we make sure we take seriously every patient we see. And I say to her, well, this is a provisional report. Provisional is not a permanent, it's not a final, it's just provisional. So I'd like a final report. The woman's scared, and she's a very successful businesswoman, right? So she's like, I'm so scared. I'm petrified about this whole thing. Let me give you some thyroid medication to make your thyroid rest because I see, and the studies support it, that, thyroid cancers sometimes come from the thyroid's overstimulated. So relax it, let it relax, and let's see what happens. And let's try to get the final report. We never get the final report. The poor woman is so stressed. And I say to her, listen, I will stand by you regardless. I have no ego in here. All I care about is about you being well. So whatever you want to do, I'm going to support it and I'll be there for you. She decides to have the thyroidectomy because we were all brainwashed that if you have anything that smells or sounds or might be cancer, immediately get rid of it. Well, maybe not. So guess what? She has the thyroidectomy. And the report comes back, and there's no cancer. But this is not alone. She's not alone. She's a majority because when we're talking about conventional medicine, and I'm a conventional doctor, and I've been saying forever I'm a conventional doctor because I feel that what I do is what medicine needs to become. Because if medicine becomes the kind of medicine I practice, we'll all be okay. We'll enjoy our lives. Like you said, we'll be well. And that's the goal. Well. Anyway, it happens all the time. So she writes to me this email that actually made me cry. She doesn't know it. It made me cry because I thought, she said, oh, Dr. Erika, you were so right. I'm so sorry. I should have listened to you, but I was so stressed. And you basically said to me, whatever works for you. And I thought, you know what? It breaks my heart that we're still victims, that we still don't have the strength to say, this doesn't make sense to me. I'm not going to do it. I'm going to wait. Because we get so scared and so intimidated. And we get intimidated by the way they throw, surgeons, doctors, and conventional medicine, throw numbers at us. And they'll say, you have a risk of 3%. First of all, it's a relative risk because you don't know what the absolute risk of you or me would be because you don't know me. So that's one thing. The second thing is a risk of 3%, let's say, or 10%, means you don't have a risk of 90 or 97%. Why aren't they saying it that way? Why are they saying it in a way to scare us, to paralyze us, to stop us dead in our tracks from living our lives? Why? We need to change that.
Oh, that's heartbreaking. And like you said, it's probably one of so many stories, and I'm sure people listening have gone through some experience that they can think of, not maybe that exact thing, but where we've kind of succumbed to that pressure. Fear. So I know that my audience really loves the science, and I would love to, if we can, just kind of break down like the major hormones and maybe the signs that they might be off, because I'm sure a lot of people listening are like, okay, at what point do I need to go in and get, I don't know, a hormone panel? When do I need to test things? When do I need to consider going on some kind of hormone replacement therapy? So what are like the major, we can talk estrogen, progesterone, just really quickly, adrenals, thyroid, whatever you think.
Whatever you want.
And kind of like what they do and what happens when they get a little bit off.
First of all, they all work together. So when we try to separate their effects, we're doing ourselves a little disservice. When you're on birth control pills, well, let me go back to your IUD story. They put in an IUD with hormones in it, and it's not bioidentical hormones, but rather synthetic hormones. They put us in menopause. They basically shut down the pituitary, which is the master organ that says make hormones, don't make hormones. And it tells the pituitary to tell the end organ, the ovaries or adrenals, to not make hormones because you're menopausal.
Sorry to interrupt, but is that the same with hormonal birth control?
Yeah,
totally.
So
that's crazy. I went on that when I was 14 because I had one pimple, and I was on it until my early 20s. Right. And I'm sure everybody listening had a similar experience.
Of course. I think that I probably am the only person who had 2 daughters in high school not on birth control pills. And they would come home and say, everybody's on birth control pills. And I'd be like, if you're going to have sex, condoms. Because birth control pills won't protect you from sexually transmitted diseases, and they will also screw up your hormones. So they eventually gave up and listened to me, and they did fine. They survived. Anyway, so when you're talking about hormones, you have to realize that we're exposed to hormones all the time. Never mind that it's in your diet, not in your diet, not in my diet, hopefully, but they're in our diet. The microplastics affect our hormones. Everything we breathe affects our hormones. So our hormones are doing a juggling act at all time. Now, let's talk about the hormones. So when we're talking about female hormones, we're talking about estrogen, which is 3 estrogens, basically, that we know of. There may be more, but only 3 have been studied. One is estriol, the estrogen of pregnancy, so that we're full of when we're pregnant. We use it when we're not pregnant sometimes to moisturize our vagina, but the truth is we don't need it. Estradiol, which is the estrogen of youth, which is what you are full of.
Oh, God.
Which is what I take supplementally for 40 years, literally. And then There is estrone, which is the estrogen of menopause, which we make, so we continue making estrogen. And that estrogen was considered reactive, that it caused cancer and things like that. Nobody knows what it really does. That's the truth. And that's scientifically the truth. So what does estrogen do? Estrogen makes things grow. Not as in cancer. Don't think cancer immediately. Think about the lining of the uterus when you get pregnant or before your period, or just your breasts. Makes things grow. The next hormone is progesterone.
Wait, can I rewind and ask one kind of aside?
Sure.
Topical estrogen cream for your face, yes or no?
You know what? The answer to that depends on how it's made. And you know that. If it is made in a vehicle, right? Like they have the liposomal, you're the expert in all of these things. If it gets absorbed, it'll make your skin stronger. And when you said that my skin looks good, it's probably because I've been taking estrogen for 30 plus years.
Okay, got it.
So that's why.
Thank you. Okay,
but I'm taking it not on my skin.
Mm-hmm. Got it.
It's the facial kind of thing. Anyway, so that's estrogen, right?
Yep.
Progesterone. Progesterone is the balancer of estrogen, right? Progesterone is actually a hormone that's only made the second half of the cycle after you ovulate. If you ovulate, it stays there forever if you get pregnant. That's it. We don't know much about it. We know that the synthetic, non-human identical, I shouldn't say synthetic, but non-human identical progesterone, that is progestin, and was that Provera, was the trouble in that study, because that caused blood clots and cancers and things like that. But nobody talked about that because they're still pushing it when they want you to have a period when your period is late. They'll give you a few, 5 days of Provera, which is kind of, you know what, maybe you should take this thing off the market. Maybe. Anyway, so that's progesterone. Now, progesterone works great to balance the growing effect of estrogen, right? It helps shrink the lining of your uterus. Maybe if you have a period, you don't really need it because it'll slough off on its own. Sometimes it causes breast tenderness. Other times, estrogen causes breast tenderness. It depends on the woman. We're all unique. So the data on it is very strong to protect from endometrial cancer, which is one of the rarest diseases that anyone has. So we're talking about making the lining of the uterus thicker, and then you immediately get a biopsy, which you don't need. But if you took progesterone, it would shrink it and you'd be fine. And then testosterone. Now, testosterone is an amazing hormone. Women make more testosterone than men. How about that one? Only they don't make the same amount. So for our sizes, we make more testosterone than men make, which should give us some pause when we start talking to some guy who's trying to tell us that they're smarter or we're less of a something. So we make testosterone. Now, testosterone is a great hormone. It protects us from Alzheimer's. It protects us from our bones falling apart. It improves our libido, as we know, and it helps us build muscle. Just a few. But remember what I said, all hormones work. They do everything. It's not like one thing only. But that's what testosterone is known for. We work with testosterone. There is no FDA-approved testosterone formulation for women. OBGYNs will tell women to take a male dose in a small amount, which I find, how scientific does that sound to you? Are you out of your mind?
I mean, it's pretty on theme for this whole conversation.
Exactly.
From what we're learning.
Right?
Yeah.
But then on the other side of the mouth comes out compounding pharmacies that make compounded hormones, make them unreliable because we don't know exactly how much there is. Well, tell me how much there is in the testosterone that you're taking from your boyfriend a little bit. How crazy is that conversation, really? Let's move on from testosterone. The next one is thyroid. Thyroid is a really important hormone. When we do our bloods, we test for low thyroid, which is the thyroid stimulating hormone from the pituitary, TSH. That number will never tell us if our thyroid's too high. So when you give someone thyroid and that number looks 0, disappears, everybody gets nervous and says, oh my God, you're hyperthyroid. You're not hyperthyroid unless you're sweating, losing weight, not sleeping at night, being hyper. That's hyperthyroid. So it's a subjective clinical thing. It's not a blood test. So that's an important thing to know.
Yeah, I've never heard that.
Now you do. So thyroid actually helps a lot. The thing is that we only give endocrinologists, conventionally trained and conventionally thinking, will give you only T4, which is the big thyroid hormone that needs to be broken down into T3 and T7 in your blood. But it doesn't. So unless you add T3, you can take T4 or Synthroid or, Levoxyl or levothyroxine, whatever you want to call it, for the rest of your life, and you'll never feel great. The moment you add the T3, which is the active thyroid hormone, which is most likely to help when you're young or old, and in the middle you can kind of take the T3, T4, things change. I wrote a few articles in one of the conventional medical literature, PubMed research.
I love PubMed.
Go to Google Scholar. It's better,
really?
Better.
Okay.
You get
Hot
more
tip.
information there.
Oh,
right. Mm-hmm.
Okay, great.
So, yeah, but PubMed's okay. They have the same ones, pretty much. I don't know why I'm telling you Google Scholar. Anyway, but I wrote an article about sick euthyroid, which is you're sick, but your numbers look good. So your doctor will say what to you? Come back in 6 months, let's test it. But you're not feeling well. Is the doctor noticing you? Are they listening to you? Because maybe a little T3 might help. So that's the thyroid. And then there's the adrenals. So as you know, the adrenals are those glands we have on top of our kidneys, which are really important. They make the fight or flight thing. They make the cortisol. They make adrenaline. They do a lot of really good stuff for us. But they also get burnt out by our lifestyles, by not sleeping, by being stressed, by watching too many blue screens, by doing everything else. So a little bit of adrenal support will go a long way. Now, adrenal support, the good news is you don't have to take steroids. You don't have to take cortisol. You don't have to take prednisone. You don't have to take hydrocortisone. You can take ashwagandha, which is an herb, or you can take bovine, powdered adrenal support. And it works beautifully. And I never give someone thyroid without adrenal support because they work together. What does the thyroid do? You know what the thyroid does. It pretty much is the master metabolic regulator. It may make you feel hot, it may make you feel cold, but the point is, because it's the temperature regulator, but it's actually the master. It tells you how many kilocalories you need a day to burn fat, to not burn fat, to grow muscle, to not grow muscle. It tells you so much more. It's such an important organ. Don't forget about that. I can keep on going, but you're going to get bored.
Well, no. Oh my gosh. I'm actually thinking I wish we had another hour because there are so many kind of topics that we can dive into here, even just for each hormone. Sure. But I think that, we
PCOS?
primarily... Oh, yeah. Let's go back to that. But I was going to say, I think primarily we think about estrogen and progesterone and sometimes testosterone and then we think of the other things like adrenal, thyroid, everything is kind of siloed off.
Exactly.
Whereas, what you're saying is that they all work in concert together.
Exactly.
Let's just circle back on PCOS and then I'll ask you my next question.
PCOS. So PCOS is pretty much the diagnosis du jour. It's kind of a throwaway diagnosis because you have nothing else you can say. Historically, it was a phenotype, right? So it was like you grew a beard, you're overweight, your periods were irregular, all these things. And then it turns out that in the studies, it was like Mother Nature's way of protecting our fertility because you would get fertile later on in life. Interesting. It's just a factoid, nothing more. The problem with PCOS is that nobody really cared about us enough to study us, to figure out what would help. Well, I can tell you birth control pills won't help. And you know that now because it's not like you want to obliterate the testosterone by giving them synthetic, non-human identical estrogen and progesterone, right? You want to actually help women balance themselves, right? So progesterone may be a good help, but your diet is going to be an even better help. Your exercise will be an even better help. Your sleep will be an even better help. And then the supplements you're going to be taking, which is your thyroid and your adrenal and everything else you're doing as you're putting the picture together. So PCOS, I would like to see less of it. I would like to hear of it, less of it. Mothers bring me their 16-year-old daughters, and it takes us very little to fix it. You know, the GLP-1s come in very handy. I've been working with peptides, and I teach peptides. So peptides are great things. They're like little proteins, as you know, and they work hand in hand with the hormones. And if you do it right and you do it caringly, the outcome is beautiful.
Does incorporating bioidentical hormones too early, does it I don't know if this is a word, de-incentivize your body to make them, or is it just added? And how do we determine what is the best point to start? Is it when we go into menopause? Is it perimenopause? Is it just whenever we're feeling like we're having these symptoms and we have to test? What is the ideal time to start incorporating?
I hope everybody listens to this answer. I'm praying because I've been doing it for so long and it's so important. Before the new experts on perimenopause, premenopause, menopause, and postmenopause came into existence, which on one hand is great because it talks about it, right? On the other hand, I used to tell patients, please don't label yourself. Labels are the worst things we can have. You're Ariel, I'm Erika. That's it. That's as far as it goes. Every one of the people who's listening to you is an individual. So it doesn't matter when or what. But you want to know that instead of going to 50 subspecialists, and that's where the disaster started about 50 years ago, even before my time, right? That it started by like what you said, siloing everybody in little silos. And if you fit in there, or if you don't fit in there, it doesn't matter. Your age fits in there, your gender fits in there, something fits in there, and then we'll just automatically have a protocol for it. It's not okay. I would love to know what our hormones are when we're feeling the best, wouldn't you? Then you know what your ideal is. And then when we start feeling like all of a sudden, when you start having hot flashes, night sweats, insomnia, you're too late. My patients don't go through that. They don't go through it because they get it earlier. Because by the time they're 35, 40, they got it. They know what they're supposed to do. They know how they're going to be doing it. And when I come in, they'll say, tell me to stop drinking. And I'll say, I will never tell you to do anything except for listen to your body. And then all of a sudden they'll be like, I stopped drinking and I feel so much better. Like, okay. Doesn't mean you'll never drink again. You'll never have a glass of champagne or whatever. It just means that you made the connection between what you did and how you felt. And that's all you need. Because once you make those connections, you'll know when it's time. And the other thing is, we're not trying to replace the hormones. We're trying to supplement them. We're trying to rebalance them. HRT was the Prema and Provera story, which they were doing before the Women's Health Initiative. What we're doing now is we're trying to find balance as early as possible, as often as possible. And then once we balance it, we stay there. Then we do the bloods, of course, so we know what ideal is when you feel great. I mean, I have to tell you, and I'm not bragging, it's more like the amount of time I hear the word magic makes me so happy. Because you know what? Within 2 to 3 weeks, it's magic. You feel like yourself. And then if you feel like yourself, you can be a contributor forever. You don't have to be discarded. You can be part of it. And I think that becomes really important. So you don't have to wait to go through perimenopause. I have everybody in my office, 35-year-olds. Everybody's like, yes, I think I'm having a hot flash. You possibly are. You know, there are a lot of things that happen. But you have to put it into context and you have to learn yourself. And then you have to look and say, when was the last time I worked out? When was the last time I ate something that wasn't junk? That kind of stuff. And as you put the pieces together, things look a lot better.
I have another question regarding testing. So if somebody is not quite at that point where they're approaching menopause or like desperately in need, but they notice that they're not feeling well throughout the month, when is the best time to look at hormones to get that snapshot of what's really going on? Because I know for myself, like, I know when I'm going to feel terrible. And it's like every week I have a different version of myself. And then I go and I get things tested and it's like all normal and everything looks good. So is there a time that really shows what's going on, or do we have to go in at different times throughout the month to get that picture?
Another great question. So it depends what you're looking for, right? If you're looking to see where you are as far as hormonal balance, you'll go the second half of the cycle and you go towards the end of it. So if you have a 28-day cycle, you go day 17 or so. Because that will tell me if you ovulated. It'll tell me what happens to your estrogen and progesterone and testosterone. It'll tell me a lot. If you're looking to get pregnant, which is what every OBGYN is looking for because they don't care about anything else, you'll do it on day 2 and it'll tell you where you are. But I don't care about that. I care about you. You know, I'm much more interested in how you feel. So it would be the second half of the cycle. And that would tell me more.
Got it. Yeah, I heard you say on another interview that something along the lines of like hormones open the door to feeling better and then you help your patients kind of walk through and figure out what else they can do.
Oh, thank you. Yeah, right. Oh, the hormones will open the door ajar. That's what I said, right? But then it's up to you to feel confident, to feel good about yourself and say, it's now mine. It's my body. I can now do whatever I wasn't doing to make it better. And then you can. There's no question about it. There's no question. It doesn't matter. There's no such thing as age, you know, chronologic age. It's all physiologic. It's about, you've said it, lifespan. It's about you feeling good. And you're going to feel great if you're happy about yourself. And if you feel confident that you own it, that it's yours, that nobody else can take it away from you anymore.
I love that. Well, I could keep going for another hour, but we're out of time. So tell everybody where they can find you, where they can buy your books. You mentioned that your re-release is coming out probably around July.
You can find me at Instagram, Facebook, at Dr. Erika Schwartz with a K, all in one, Drerika Schwartz. The books are all on Amazon. Our practice is called Evolve Science. It's got the handles ES Health, and that's on Instagram too. I have a podcast, which is A4M, which is the American Academy of Anti-Aging Medicine, which actually trains the providers that should actually become those who help us stay well.
Got it. Amazing. Well, it was such an honor to have you. Thank you so much.
It's my honor. Thank you.
Thank you.